Hey everyone, and welcome to This Explainer. Today we're stepping into the shoes of a rehabilitation specialist to map out something that is honestly incredibly complex, but deeply, deeply personal for so many folks: the chronological journey of recovery following a traumatic brain injury, or TBI. Now, if you or a loved one are on this path right now, you know firsthand that the medical jargon and those uncertain timelines, they can feel like a total maze. So our goal today is to clear away all that confusion and give you a really structured, evidence-based look at the road ahead. So, how long does it really take to recover from a TBI? It is, without a doubt, the single most common question asked by survivors and caregivers standing right there in the hospital room. And if you're asking this, I want you to know your feelings of being totally overwhelmed by the future are completely valid. Every single brain injury is unique, which means the timeline is kind of different for everyone. But by looking at the clinical data, we can absolutely set expectations and define clear goals to help you navigate this. Okay, let's dive into this. Today, we're going to cover the early awakening stages, that accelerated healing window, how to overcome recovery plateaus, the amazing science of neuroplasticity beyond the 2-year mark, and vital psychological support. Let's demystify this whole timeline together. Section 1. The early stages, awakening. Right, so in that 0 to 2 month window immediately following the injury, the brain is focused entirely on stabilizing and bringing down the swelling. During this really early stage, a survivor might pass through 3 distinct states of consciousness. It's often a super confusing time for families, so let's bring some clinical clarity to it. Step 1 is a coma. That's the absolute deepest state of unconsciousness. There's no eye opening, no communication. Step 2 is a vegetative state. Here, the eyes might actually open and close, and the person might seem awake, but they aren't actually aware of their surroundings yet. Their movements are just involuntary reflexes. Finally, step 3 is the minimally conscious state. This is when the survivor starts showing inconsistent but intentional reactions, like maybe responding to a sound or a touch. Moving through these stages, it's a major sign of emergence. Now, once a patient becomes a bit more alert, they frequently enter a phase called post-traumatic amnesia. And I'm not going to lie, this can be incredibly distressing for families to witness. The survivor might lose past memories, they might struggle to form new ones, and they can even display uncharacteristic aggression or severe confusion. But I want to firmly remind you here, this behavior is just the brain trying to process overwhelming stimulation while it's healing. It is almost always a temporary condition that fades over a few days or weeks. Section 2. Accelerated healing, months 3 to 6. Once a survivor emerges from those early altered states, they enter what we call a golden window of recovery. In that 3 to 6 month window, the brain is in a highly accelerated state of healing. Actually, this is when we usually see the absolute greatest gains in physical and occupational therapy. By the 1-year mark, clinical studies show that an impressive 64% of TBI patients make a good cognitive recovery. And looking a bit further out to the 2-year mark, roughly 50% of individuals with moderate to severe TBIs regain the ability to drive, often with some modifications. So progress is happening rapidly here. Section 3. Overcoming plateaus. Evidence-based rehab. But, what happens when that rapid, visible progress suddenly just seems to slow down? Well, there's a massive difference between what we perceive and what is actually happening. A perceived plateau makes you feel like your functional progress has completely hit a brick wall. But clinically, under the surface, it's actually a period of intense active healing. Think of it like your brain's secretly utilizing the daily stimulus from your exercises to facilitate invisible structural growth. These plateaus are temporary. You absolutely must stick to your daily exercise grind because all that repetition is literally rewiring your brain for its next big leap forward. To push through those frustrating plateaus, we rely heavily on clinical practice guidelines. We can translate those dense medical recommendations into very practical functional goals. Physically, we target functional mobility, things like sit-to-stand skills. Cognitively, we improve executive functioning using memory strategies and goal management. And behaviorally, we're aiming for emotional regulation through specialized neurobehavioral programs and direct insight feedback. A multidisciplinary team tackles all these domains at the exact same time. And how do we execute all these goals? Well, the evidence strongly supports some very specific tactics. Repetitive, task-specific practice for daily living activities is huge. We also use cognitive feedback and visual scanning training to help the brain adapt to any sensory deficits. By using metacognitive strategies, which is essentially teaching the brain brand new ways to solve problems, we force the brain to adapt. Repetition and constant feedback, those are your master keys to unlocking that stalled progress. Section 4, Beyond 2 years, neuroplasticity. For a really long time, there was this very outdated medical belief that whatever recovery you made in the first 2 years, well, that was all you were going to get. But modern technology proves otherwise. By tracking the incredibly complex neural pathways of the human brain, using tools like diffusion tensor imaging, we can see the science of neuroplasticity in action. It turns out the brain's pathways possess this remarkable, almost magical ability to continuously reroute and rewire themselves. And not just for months, we're talking for decades after an injury. Let me give you a number to put this into perspective. 10. Recent clinical studies tracked TBI patients for over 10 years post-injury. And get this, they found individuals who, at year 2 and even year 5, still required daily assistance. But by year 10, simply because they stuck with their therapy, those exact same patients transitioned to regaining complete functional independence. It's incredible. The absolutely crucial takeaway here is to never, ever give up on your therapy. Regardless of how long ago the injury occurred, your brain is always capable of growth and adaptation. With enough stimulation and dedication, our brains are always able to grow and adapt through neuroplasticity. Section 5, Psychological and Caregiver Support. Now, while the survivor is doing the incredibly hard work of physical and cognitive rehab, we absolutely cannot ignore the home environment. The psychological toll this journey takes on literally everyone involved is immense. Clinical guidelines heavily emphasize that rehabilitation isn't just about physical mobility, it has to be about holistic support. This includes cognitive behavioral therapy, or CBT, to really help the survivor manage acute stress and anxiety. It means actively modifying the home sleep environment, since sleep disturbances are just incredibly common post-injury. And importantly, it mandates strategies to manage caregiver burnout. Caregivers, listen to me, you are the unsung heroes of this journey, and you need proactive support, peer mentoring, and group therapy just as much as the survivor does. Don't forget to take care of yourselves. Ultimately, we have to reframe how we view brain injuries entirely. A TBI is not just an isolated, one-off event that you treat and then forget about. As noted by the CDC, particularly when injuries occur in childhood and echo all the way into adulthood, TBI is a chronic health condition. It requires ongoing screening, symptom management, and lifelong care strategies. Recognizing it as a chronic condition is actually validating. It validates the long-term effort required from both the patients and the medical providers. Wow, okay, we've covered a tremendous amount of ground today. From navigating those frightening early days of a coma, all the way to understanding the empowering, lifelong potential of neuroplasticity. So, I want to leave you with this final provocative thought. If your brain has the capacity to heal and adapt over an entire lifetime, what new milestone will your dedication unlock tomorrow? Keep pushing, keep practicing, and trust in the incredible resilience of the human brain. Thank you so much for joining me for this explainer, and I'll catch you next time.